Hi, I'm Dr. Vincent Zubowicz. I'm the medical director of Thrive Medical Spa, and we're proud to present a video series on GLP-1, also known as semaglutide. I hope you enjoy it.
GLP-1 agonists are a class of biologically active peptide drugs that cause metabolic changes in the body similar to the normally produced hormone glucagon. Peptide hormones are made up of amino acids similar to protein hormones, but somewhat smaller. The drugs have many advantages, particularly in patients with type 2 diabetes, including weight loss. For this reason, because of the epidemic of obesity, it has become especially popular in patients wishing to lose weight even if they don't have diabetes. However, their role is very complicated and patients differ in their response to the GLP-1 agonists. We'll try to unravel this topic for you. Glucagon. Glucagon is a polypeptide hormone produced naturally in the pancreas. It is produced by the alpha cells. Glucagon works with insulin, another enzyme produced in the pancreas, but by the beta cells. These two function together to balance the level of glucose in the blood. Glucagon increases glucose levels, whereas insulin reduces glucose levels. This seems simple enough, but this balancing act is actually metabolically quite complicated. In addition, there are other metabolic effects not directly related to blood glucose management. When blood sugar needs to be elevated, such as in exercise, glucagon orchestrates the breakdown of glycogen. Glycogen is a complex carbohydrate storage molecule to the simple molecule glucose that is used as fuel by the cells in the body. In a non-fasting state, almost all of the glucose is derived from glycogen in the liver primarily, but also in the muscles. In the fasting state, and this is important to know, by a process called gluconeogenesis, glucose can be derived from the breakdown of fat. Of course, that's good if you're trying to lose weight. But gluconeogenesis can also break down protein, that is muscle, to derive glucose. This is clearly an unwanted situation when trying to lose weight, as it leads to weakening of the muscles and subsequently weakening of the bones. GLP-1 agonists, the glucagon-like peptides. Agonist is the opposite of antagonist and are not identical to glucagon. Thus, the descriptor "like" in the title. The ultimate molecular structure is chosen to enhance certain desired properties, such as duration of action, slower degradation, etc. Thus, there are categories of GLP agonists that have been established, but we'll not go into that for now because there's so much detail involved. Focusing on weight loss metabolically, a number of mechanisms contributing to this process. GLP-1 agonists slow emptying of the stomach, which allows for more rapid development of satiety while eating and prolonging that same feeling of fullness when a meal is finished. GLP-1 agonists target receptors in a region of the brain called the hypothalamus, which results in the feeling of satiety even with an empty stomach. These central nervous system interactions also reduce food craving, interrupt the emotional reward in the eating cycle, and decrease hunger. All of this results in less caloric intake and thus facilitates weight loss.
Hey you guys, it's Emily here, one of the nurse practitioners at Thrive Medical Spa. I wanted to talk a little bit about some of the positive side effects of GLP-1 agonists. Benefits beyond just weight loss have been identified when using GLP-1 agonists like semaglutide. We've seen an improvement in the blood lipid profile, like cholesterol and triglyceride levels. And then overall improvement in cardiovascular health may also be seen, such as protection against stroke. And then we've also seen that there's a lot of anti-inflammatory effects, and this can range from possible improvement in the severity of psoriasis, joint pain, and then also protection against Parkinson's and Alzheimer's disease. All right, and then next I'm going to talk a little bit about the route of administration with these drugs. Most GLP drugs are delivered by injection. Common sites include the fatty portion of the abdomen, the upper arms, and then the thighs. And then most patients will inject themselves once a week, but we have in-office visits available for patients who would prefer one of the providers inject them.
Hi, this is Julie from Thrive Medical Spa. To continue our educational video series on GLP-1, I'd like to cover what you can expect from Thrive Medical Spa regarding patient monitoring and any potential unwanted side effects. As patients are administered the GLP-1 and weight loss ensues, it's important to monitor for any side effects as well as metabolic changes. This is done by listening to the patient's subjective observations like nausea or weakness. Blood tests are recommended periodically to monitor any unwanted responses to this medication. The patients must be officially weighed throughout this process. Often this will lead to an adjustment in your medication. Injections are started with small dosages. If effective, that's where the dosage will remain. Most of the time, however, the amount given has to be incrementally raised to achieve weight loss with the least number of side effects. Coaching on the importance of a healthy diet and resistance training is part of the patient management here at Thrive. We want to ensure that the patient is losing fat and not muscle mass. Thank you for listening and hope this has helped educate you on GLP-1. We offer free consultations at Thrive and would love to answer any other questions that you may have.